Hi friends, it's time for our Ask the Doctor segment with Dr. Hanna Merchant. Hi Dr. Hanna, thank you so much for being here.
Thank you so much for having me, Val.
Let's dive right into it today. Fact or myth, can medical conditions skip a generation?
So when we say skip a generation, that means that as maybe a parent has a specific medical condition, the next generation, that medical condition is not there in that parent's children. And then the next generation, you actually see appearance of that medical condition again. While that may seem really mysterious, it actually is a reflection of how our genes work. So basically, the way genetics works is that you receive a set of genes from one parent and a set of genes from another parent. We have what's called dominant versus recessive genes.
Okay.
Dominant conditions mean that you only need to receive one set of genes from a parent to have that condition. That doesn't mean that they'll have the same symptoms as the parents do. They can have very mild symptoms or no symptoms at all. So that looks like it's skipping a generation.
Okay.
When in actuality, that child does have the gene and can pass the gene on to their own children. So the dominant genetic disorders, there are quite a few. There are neurodegenerative disorders. There's a form of dwarfism that's a disorder. There's also cysts in the kidneys. That's not always something that's genetic, but it's something that we do look for. Other dominant conditions that can cause tumors, there's genetic hearing loss, and then there's one that we actually see not too rarely, which is called familial hypercholesterolemia. And so sometimes we look for familial hypercholesterolemia, especially if there's high cholesterol that seems to be ongoing within a family, within different generations, and it's not responding to any of the typical medications. Now, the skipping generation comes with recessive conditions. And recessive conditions means that you need to have one gene from one parent that carries the condition, and then a gene from the other parent that carries the same condition. Even if they have that condition, they may not necessarily express it as well. So if they don't, then it goes to the next generation again. And the next child could also receive two of those recessive genes.
I've never heard of genetic testing. How do we know when to get that and which doctor can perform that?
If there's a dominant condition or recessive condition within a family, then the physician will and can and will refer a patient to a geneticist to then do a real deep dive into a family history. Seeing a geneticist will help predict the likelihood of transferring a gene onto a child and can help with early diagnosis and prevention as well. For instance, breast cancer runs in the family, then you can do genetic testing for specific breast cancer genes.
Oh, I see, makes sense, okay.
Same thing with colon cancer.
Yeah.
Some common recessive conditions that we see, there are certain types of anemia, thalassemia, and also bleeding disorders that can be recessive conditions, and then cystic fibrosis. That's dominant and recessive. There's a whole nother category which is more of environmental. And that's where things like heart disease really come into play. Because you can have a family history of heart disease, but that doesn't mean that you will have heart disease, and it doesn't mean you can't do anything about it. So it's really important to address those environmental triggers when you can.
Thank you so much, Dr. Hanna. Always such great and valuable information. So friends, make sure if you have any health concerns to work closely with your primary care physician, and be sure to get your regular routine checkups. For more pro tips, head to our website, fashionsensehawaii.com, where you can also submit a question for our expert. And be sure to subscribe to our YouTube channel for more pro tips. Presented by D. Suihiro Electric Inc. on Spectrum OC16.